Hi, how are you today?
Good, how are you?
Good, my name is Shaine. I'm going to be your student nurse today. I'm just going to wash my hands. We're going to be doing a full health assessment on you today.
Okay.
Tell me your name.
I'm Olivia Geller.
What's your date of birth?
February 17th, 1999.
Okay, I'm going to check your wristband. Okay, perfect. Can you tell me where you are today?
Georgia Court University.
What's today's date?
December 10th, 2018.
And who's the president?
Donald Trump.
Okay, good. You look alert and good. The bed's good in full position. Your posture looks good. Everything looks good. Okay, you need to use the bathroom or anything?
No.
I'm gonna ask you if you had any pain today, and you had to rate on a scale from 0 to 10, 10 being the worst pain ever, what would your pain be?
0.
Okay, perfect. Now I'm gonna take your blood pressure. So can I have your right arm, please? Okay, perfect. Your blood pressure is normal. About 118/76, that's good. Now I'm going to take your pulse. Also, I'm going to take respiration, so give me your left arm. Okay, good. Respirations are about 16, pulse is 72, so that's all normal. Next, we perform temperature and pulse oximetry. However, we don't have any of those tools here, so we're just going to pass over that. I'm going to perform stereogenesis and graphesthesia. I'm going to place something in your left hand. I'm going to ask you to close your eyes, and you're going to tell me what it is. So can you close your eyes? Tell me what that is.
It feels like a pen or pencil.
Okay, perfect. Now I'm going to take your right hand, and I'm going to draw a letter in it, and I want you to tell me what the letter is. Close your eyes, please.
H.
Yeah, perfect. Next, we're going to test your cerebellar functions. I'm going to ask you to take your right heel and bring it up top to your left shin and down to your heel. Perfect. And then do it with the opposite leg. Okay, perfect. Now we're going to test your balance. So I'm going to ask you to stand up. We're going to perform the Romberg test. You're going to stand in front of me and put your arms out. Just stand there. Okay, perfect. And close your eyes. Okay, perfect. You can sit back down. Okay, now I'm going to assess your skin, and everything looks pretty good. It's not too dry. I'm going to assess your skin turgor, so I'm going to test for hydration. See how hydrated you are. Okay, perfect. Hydrated, everything looks good. Next, I'm just going to inspect your head and your face and your hair. So, I'm just going to look. Okay, perfect. Everything looks symmetric. Okay. I'm going to check your joint. Can you open and close your mouth? Yep, perfect. Okay, now I'm going to check your sinuses and your lymph nodes right here. Okay, perfect. Everything looks good. Everything looks symmetric. Okay, next I'm going to check your eyes. Just look at this pen and follow it for me. Okay, next I'm just going to test the reflections in your eyes. So I want you to look at me. Okay, perfect. Pupils look good. Okay, perfect. Okay, now I'm going to pass palpate your maxillary and frontal sinuses. Okay, that's good. And we're just going to do the rest of your lymph nodes. Can you tilt your head forward for me? Okay, perfect. Okay, next I'm going to check your nose. I'm going to ask you to close your eyes. I'm going to ask you to breathe in and tell me if you can identify what that smells like.
It smells like Purell.
Okay, perfect. Now I'm going to ask you to hold one side of your nose and breathe in. And do the same for the opposite. Okay, perfect. See for any drainage. Check for any drainage. No, close your mouth. Thank you. Okay, perfect. Okay, next I'm going to check your throats. Can you open your mouth for me, please? Check the... Okay, next I'm going to check your pulses. I'm going to check your... I'm going to do it at the same time bilaterally, so I'm going to check your radial pulse. Okay, 2+. I'm going to check your brachial pulses. 2+. I'm going to check your carotid pulse. 2+. I'm going to check your temporal. Okay, perfect. Now I'm going to check your heart sounds. I'm just going to listen, so if you can... You sit up straight for me, please? Okay, I'm going to check your aortic heart sounds. I'm going to check your pulmonary, herbs, tricuspid, and mitral. Okay, perfect. Everything sounds normal. Now I'm going to check your breath sounds also for respiratory. So your vesicular sounds are on this side. Keep breathing for me, please. Breathe again. Another one. Okay. Okay, now I'm going to check your breath sounds in your back. So can you take a deep breath in, please? Okay, another one. Another one. Another one. Another one. Okay, perfect. Everything sounds normal. Next, we would check your eyes using the Snellen eye chart. We don't have one of those here, but I would ask you to read a line to see where your vision's at, if it's 20/20 or not. But next, we're going to skip to a range of motion. So first, I'm going to ask you to put your arms up, all the way up. Okay, now put your arms down. Then can you move your head side to side for me? Okay, perfect. Now up and down. Okay, perfect. Now I'm going to check your resistance. So I'll put my hands here, and you're going to move your head towards my hand. Perfect. Now other side. Perfect. Now you're going to do it down. Perfect. Okay, now I'm going to do the shoulder test. So I'm going to ask you to shrug your shoulders for me. Shrug your shoulders. Yeah, there you go. Okay, now we're going to do the grip test. So you're going to hold my fingers. You're going to push them. Now pull. Okay, perfect. Okay, now I'm going to inspect your abdomen. So I'm going to ask you to lay down. Can you lift your shirt up for me, please? I'm just going to inspect it so there's no contours, it's flat, everything looks good. Now I'm going to auscultate for bowel sounds. Okay, good, everything sounds normal. Now I'm just going to use the bell of the stethoscope to listen for bruits in the aorta, abdominal aorta. Okay, everything sounds good. Now I'm just going to percuss. I'm going to percuss the liver and the spleen. Okay, perfect. Everything's normal. And now I'm going to palpate. I'm going to palpate lightly at first, so if you feel any pain, let me know. I'm just waiting for the liver and the spleen. Okay, now I'm going to do deep palpation. I'm going to go in deeper. Okay, everything feels good. Now I'm going to palpate for the abdominal aorta. Okay, perfect. Now I'm just going to percuss your back. We're going to go in the Z formation. Okay, now I'm going to check for tactile firmness. So I'm going to put my hands here, and I'm just going to ask you to say 99.
99.
Okay, do it again for me, please.
99.
Okay, perfect. Lay down. I'm going to check your popliteal pulses on both sides, behind the knee. Okay, perfect. They're both 2+. Now I'm going to check your dorsalis pedis pulse on top of the foot. 2+. I'm going to check your posterior tibial pulse. Okay, perfect. 2+. Now I'm going to check for pitting edema along the tibia. So I'm just going to feel. Okay, perfect. Everything's normal. Okay, everything's normal. Now I'm going to check for capillary refill in your toenails. So I'm going to hold down your nail. Okay, perfect. 1 second. Okay, perfect. Thank you. Now I'm going to check your range of motion in your legs. So I'm going to ask you to bring your foot up and back. Bring your left foot first. Up and back. Okay, perfect. Now up and down, the right foot. Okay, perfect. Now you're going to bring your leg up for me. You're going to bring your knee in. You're going to go out. Perfect. Now do the same thing with your right leg. In, out. I'm going to ask you to sit up so I can check your capillary refills in your fingers. I'm checking for any blanching. Okay, perfect. All refilled within 1 second. Okay, so if I were to look at your ears, I'd use an otoscope, and I would look in your ears, and I would pull your ears up and back, look for the pearly white tympanic membrane. We don't have an otoscope, so I'm just going to go over that. I'm going to perform the whisper test on you now. So I'm going to ask you to, I'm going to ask you to go to the end of the bed, right over there. So I'm going to go behind you and put one finger in your right ear. Now I'm going to say 3 words. I want you to repeat them after me. Red Lake Lacrosse.
Red Lake Lacrosse.
Okay, perfect. Now we're going to do the other ear, so sit over there. Apple, orange, woman, dog, park. Now I'm just going to check your PMI, which is point of maximum impulse. Just going to sit up for me, please. Okay, perfect. Now I'm going to check for jugular vein distension. So I'm going to ask you to look that way. Like this. Okay, perfect. Everything looks normal. Do the other side. Okay, perfect. Everything looks normal. That completes my head to toe assessment. Thank you to my patient, Liv Geller. Thank you.